I'd like to welcome everybody to our weekly webinar here. Today we're going to be varying just a little bit from our traditional topic, which is on practice site selection. And I'm going to be doing that because I own the company. No.
Bottom line, he's the boss.
Bottom line is I'm in charge. Here's what I'm really saying. There's an article that is coming out in May I think they call it Health is the name of the publication. It's owned by The Atlantic, and they're also running this article. It's a very controversial topic, and it's really going to affect dentists specifically. But please be aware, for those of you who are not dentists, this is going to be a big deal for you, whether you're a chiropractor, a veterinarian, a physician. It all comes down to the same key factors, and I think we need to talk about it. And we shouldn't sit back about it. So do you mind if I just kind of jump right into this?
Jump in, Scott.
Okay, so here's the thing. The article is called The Truth About Dentistry, and it is being very widely distributed. I mean, amazingly distributed. Several publications are running it in whole and in part. There are lots of news magazines on the internet as well as on broadcast television talking about the topic. They have another title for this thing. It's called, Is Dentistry a Science? Now, you may be wondering, Scott, why are you talking about it? You're not a dentist, and that is true, I am not. But there is a reason why I think I'm kind of stepping up to the plate to express opinions about this and help our doctors who are watching and listening to sort of figure this out. By the way, there is a version of this that we're doing that's only audio that you can also find on our website at drdemographics.com, and as well as dentaldemographics.com. I knew that. Now, you may say, well, Scott, why are you the one talking about it? Well, let me just tell you, there's a couple of things about this article and about this topic that I think are going to be particularly relevant. One of those things is this. I happen to be a communications professor at Utah Valley University. So I teach public relations. I teach strategy and writing public relations. I've been doing this now for a very long time. I have my graduate degree in mass communications, and I am also the former marketing manager for the California Dental Association. It was my job to formulate positions on a wide range of issues to help present dentistry to the public and to the media. So that's been a thing I've done, and I've done it for a long time. And this is a topic that I think may need the examination of some professionals. I'd be honest with you, I'm not entirely sure that organized dentistry knows exactly how to handle the topic because they are at some risk, to be honest with you. Now I won't go into why they're at risk. I'm simply going to say that the direction for public discourse for them is difficult, and they're afraid of being sued all the time. And I won't talk to you about the Hydro Level case, which is a case that deals with nonprofit associations like the American Dental Association and others. So it's just one of those things that I think, I'm sorry about that. For some reason, this thing always jumps up and wants to say something. So let me keep moving along. Can you see me okay there, Mike?
Yep.
Okay.
You look fantastic.
And that's all that really matters, to tell you the truth. So I've been dealing with these issues for a long time. Now I'm going to go back to tell you, I was a person who was talking about the denturist situation, capitation dental plans, the busyness crisis. I mean, I've been with a lot of these public issues for a very long time. I've also consulted for many, many dental associations, constituent and component societies throughout the United States. And no, I don't talk about it all the time. Dr. Demographics is primarily to help people figure out where to put a practice and what's going on within the industry. So I'll just say I've been around the block a little bit. Now, when it comes to this particular article, the author, whose name is Faris Jabbar, I guess that's how you pronounce it, it's J-A-B-R, wrote the article, and as the face of the article, the human interest segment, they take after a fellow named John Robert Lund, who was a dentist in San Jose, California, who was accused of overdiagnosis and overtreating. Ultimately, the courts are suing him, and he may lose his license. It also happens that I know Dr. Lund, or at least I've been in his office and had conversations with him, so I have a little bit of a sense, like, yeah, I kind of know what's going on here. And I thought that might be of use and maybe a little help. I want to talk to you about what you should be talking to your patients, your friends in the media, and other people who are interested in your career, what they ought to know about this issue and how to respond to it logically. So if you don't mind, I'm going to do my own little take on this. I have no special knowledge of Dr. Lund, nor about the charges against him. I'm saying that right up front. Dr. Lund and I agreed on some things and disagreed on some other things, and pretty vociferously. I'm just going to leave it at that, because my relationship with him is between he and I. And I don't have anything to really contribute to the legal side of this. But I do want to say outright, you and I both know this. There are lots of people in the world who are jerks, people who are too aggressive in their diagnosis and treatment. There are, in fact, doctors, and I'm not going to limit it to dentistry, who do lots of things that are going to be supposedly in their own interest. And they may be doing it for reasons of greed, perfidy, and maybe fear. Now, let me explain what I mean by that. There are freedoms that a doctor has in order to diagnose and treat, and there are remedies when people are accusing them of doing that. Now, the reason that I don't know if Dr. Lund truly overdiagnosed or not is because I haven't seen his x-rays. Even if I did see his x-rays, I'm not a doctor. And I have no way, therefore, of objectively saying this is beyond the scientific standard or the treatment standard in care. I'm going to say that definitively. Even though I am in dental schools all the time, I deal with dentists every day, and I have an extremely long history, 35 plus years of dealing with professionals. But I don't know a lot of things. And by the way, neither does Faris Jabbar. He doesn't know what he's talking about. Now, he is a journalist who happens to live in Oregon and writes extensively on a lot of different things. But he got this idea, talking to a few people, that, my gosh, we need to show that dentistry is screwing the people that it's working with. I'm going to read to you one quick little part of his paragraph. The title of the piece is, of course, Iatrogenic Dentistry. By the way, let me just express real quickly, just in case you're one of those rare people who doesn't know what iatrogenic patterns are. And that's when a healthcare provider does damage to a patient. The name of my article is Iatrogenic Dentistry and the Media, because there's an iatrogenic effect that writers like this are, well, they're going to harm the public. So, as he says in the article, when you're in the dentist chair, the power imbalance between practitioner and patient becomes palpable. A masked figure looms over your recumbent body, wielding power tools and sharp metal instruments, doing things to your mouth you cannot see, asking you questions you cannot properly answer, and judging you all the while. The experience simultaneously invokes physical danger, emotional vulnerability, and mental limpness. Now, I don't want to curse on my own podcast, but frankly, I think it's a little over the top, because what he's trying to suggest is, doctor, you, by the very nature of what you do, you're probably not a scientist, and you're harming people, at least scaring them or intimidating them into doing things. He says this throughout his article, and he tries to use Dr. Lund as the example. And there is one other doctor that he uses. Now, he doesn't say how often this happens. That's a journalistic trick. Now, I'll be honest with you, as I'm dealing with my students about media relations, one of the things the media will do is they'll make an unfounded allegation, and they'll use a real example that they can back up and say, that's how everything is. That's how everybody is. Well, you guys, dentists are not like that. I'm not saying there are not some dentists who are that way. There are. You know it, and I know it. There are some people who decide to overtreat and overdiagnose. You know that there's also a lot of doctors who undertreat and underdiagnose, and it may be for greed or fear as well. You all know that capitation dentistry, if you do happen to know anything about it, used to pay people who'd sign up for the capitated plan so that you would provide all necessary dental procedures that that patient needed for a year. And the object of that kind of plan is for the doctor to do as little as possible, because that's all money out of his pocket or her pocket, and therefore there is a disincentive to serve the patient. So overtreatment and undertreatment are really two sides of the same coin, and I'm going to state this emphatically, in my humble opinion, and I say this often. Anything that gets between a patient and the doctor is going to be harmful. And when the insurance comes in and starts trying to regulate what can be treated or what is allowed or what is ethical, even though they are not themselves a provider, I think is a bad thing. Something bad is going to happen every time, either over or under treatment. Ultimately, this imbalance of power, however, is inherent in every healthcare and, in fact, every professional practice, regardless of whether it's a healthcare practice, dentistry, medicine, or it's an accountant or an attorney or a tax preparer. There is always going to be an expertise that other people have that are going to affect or influence those people. There is a power imbalance inherent whenever you have an expert. Now, this whole idea that somehow you should be able to look inside your own mouth and examine what a person is doing and evaluate somehow whether they're doing it right or wrong is ludicrous upon its face. Now listen, you happen to know that if you had a mirror looking inside your mouth, it would be hard to see. And I have a lot of doctors who like to use an intraoral camera as often as possible for the feeling that the patient should be participating in that care. The vast majority of patients, to my experience, will look away and they don't want to see it. That's because inside your mouth is a little bit goopy, bloody, scary, okay? They don't know what they're looking at. And one of the experiences that I've had is when we've talked to patients after treatment, we've asked them, could you tell me what the doctor did? And the vast majority of them can't remember even what quadrant of the mouth was treated. When asked what the name of the procedure was, they don't know. Was it bad? They'll often say things like, well, I laid back, he put my mouth to sleep, and there was smoke coming out of my mouth. That's the firsthand experience of people who were observing what was happening. So to have Jabbar suggest that somehow you are inherently doing something wrong because of your role as a healer, doing things that people don't understand, is an iatrogenic effect of journalism upon the safe execution of not only dentistry, but lots and lots of other healthcare procedures. My sister right now is receiving chemotherapy for cancer. I just took her this morning, as a matter of fact, for another session. In case you haven't been through it with someone, it's awful. It's painful, and it's nauseating. She's going to come home, and not today, but probably tomorrow, won't be able to eat. We'll have to lay her on the couch. I have to do everything for her because she can't get up. That's what they call an iatrogenic effect. It's a negative that comes because of healthcare. But the question really comes down, Scott, would you want her not to have that treatment? The answer is, of course not. This is the best chance that she's going to have to regain health and stability. Now, my sister teaches nursing, may I point out. She's a nurse practitioner and is remarkably good at it. Her students love her and everyone else because she's good at what she does. But as familiar as she is with the healthcare procedures and even the doctors who are treating her, she knows this is going to be a bad experience, just like almost every patient who gets endodontic care or a root canal or an extraction or periodontal treatment or a prosthodontic procedure, any kind of prophylaxis. It's painful, it can be expensive, and you always kind of wonder, is it necessary? The question doesn't come down to whether or not it's a good idea. It comes down to ultimately ethics. Now I want to talk about dental ethics and medical ethics for just a second because it sort of subsumes everything in dentistry as well. We all know who Hippocrates was and the Hippocratic Oath. There are several versions of it, as you probably know. But the Hippocratic Oath ultimately says, first, do no harm. I don't think that was in the original Hippocratic Oath, but it's been kind of adopted when it's been administered. Do no harm. I only wish that everything didn't cost anything, or that it wasn't going to be painful at times. And you can interpret, therefore, is this really necessary? Certainly, the role of the dentist leaning over you with sharp instruments and needles and things like that to treat you may be perceived as an intimidating and frightening thing. Well, the truth is, it is. But that doesn't mean it's not necessary or good. And ultimately, we have to come down to one primary standard. Is this person who's doing this meaning to harm you? Now, dentists don't take the Hippocratic Oath, at least in most states they don't, or a version of it. But that principle of healthcare, of trying to do good for your patient, trying to do what is reasonable and, according to the medical standards of the time or the dental standards of the time, appropriate, that's the issue. Is it? Now, there are some doctors who don't. May I point out real quick that Dr. Lund has been prosecuted not just by the state, which is all-knowing and all-seeing, but rather by the dental community, which through peer review said, this is not right, what's happened. Now, I want to kind of go back to something I said earlier. I don't know if Dr. Lund did right or wrong because I'm not a clinician. I don't have the ability to read his x-rays or his cases. I don't see the records. I don't know. And neither does anybody else, except for the peer review board, who are also practitioners and happen to know what is right and wrong and recommended. They do know. That is why, if you're going to judge a professional, we always have a peer review option, other doctors. Now you may say, hey, well, they're all in league together. And the cynic will agree they all are. But remember, every learned profession uses a peer review because they're the only people who are in a position to really understand the necessity and the quality or the viability of treatment. That is something that I want you to make sure you tell your patients. That is always available to other people, to have somebody who does know to be able to come in, because you don't know if your professional is good. Now, some people are saying we need to have a standards board. Jabbar says this in the article, some sort of an objective board that will say, these are the indications in which a person should have a particular treatment. Let's say it's a root canal. And we know that if decay is found within the dentition or the pulp, this is what we need to do. Well, the problem with this in healthcare is something that I also want you to tell people. People can have identical x-rays, and the indications may be a very similar case, and yet the outcomes won't always be the same. That's because we're dealing with living tissue, which seems to have its own little opinion as to what is going to be good and work and not. Two people can receive exactly the same medical treatment, and one will live and one will die. It is not a thing that is determined by the competence every time of the doctor. Oh, sure, incompetence occurs. But we also know that there are things that happen that are not within the control of the doctor. And any time that anybody says that it is, and that there should be some board that will know absolutely what would be right and wrong, is wrong. Ultimately, all a panel can do is to set parameters for care. If this tends to be here and that tends to be there, finding that space within the middle for treatment options is what the doctor does. That's what a panel may recommend, the parameters, not the actual procedure that needs to be done. Now, I need to say this because socialized medicine usually says that there is an indication of what that parameter is, and it's very, very narrow typically. That's why so many patients who are within the guidelines of that kind of socialized medicine die or have bad things happen to them. Oh, I know, they're going to say, no, it's free because, and all this. No, guys, when you have a professional whose job it is to care only about you, you have all kinds of power, all kinds of options within medicine and dentistry to receive the best possible care. That's why we do what we do. Now, going back to this idea that there are parameters that are acceptable, that's what a panel would then come back to do. But there are still people who say every procedure needs to have a second opinion, maybe a third opinion. So do you really need to have that extraction? Do you really need to have that surgery? Do you? Well, you can always go to another doctor who's competent, who will then do the same examination and will then give you the options for treatment. They may not treat you, but they're going to give you an opinion, an informed opinion based on their experience and observations. I really want to make sure that everybody understands you can always get a second opinion, but who's going to pay for it? Does the government pay for a second or a third opinion in socialized medicine? They do not. You pay for it. And that's going to be true in the United States as well. Insurance doesn't allow you to shop around for different opinions, whether you like them or not. You're placed in an ethical conundrum if you've gotten a recommendation from a doctor, your doctor who knows you, that you should have this particular procedure. You may then go to another doctor who gives you their opinion. Well, if they're in agreement, terrific. But who says they're not in cahoots? Who says those doctors are not, in fact, cheating you? Well, you don't know because you're not a doctor. Now, what happens when you have two providers who are telling you opposite things? Oh, this is definitely a good thing, or that's a terrible thing. Are you in a position to know? Ultimately, it all comes down to this. The credibility of the doctor is the thing that's at stake. It isn't the thing that some journalist is going to be able to say, oh, this is the best thing, or a panel's going to know. They don't, and they won't. And many people can then go throughout their days spending all kinds of money to get lots of opinion and no treatment at all, and they're still left trying to decide what the right thing to do or not is. And that brings me back to the point about dentistry and about your dentist. Now, ultimately, knowing your dentist, knowing them well, knowing the kind of credibility they have, and the length of time that they're willing to explain the procedures and to answer your questions, that matters a lot. If the doctor cannot explain to your satisfaction and even show you in x-rays and maybe intraoral examinations what is really happening, and you don't trust them, don't use them. Now, I'm going to say this. I have actually had doctors who've overdiagnosed that have provided things for me. One of them, I actually had to leave the office. I'm not a physician. I'm not a dentist. But I said, I think that's too many prophies within a year. I think we're getting a little carried away. No. Now, you may say that I made a right decision or a wrong decision. The thing is, I made my decision, and it was based upon not my clinical expertise, but rather the credibility of the people talking to me. And in the end, that's all we have. So if you have your taxes prepared by a tax preparer, if you are negotiating a lease and you happen to have an attorney, or an agreement of any kind, an attorney's involved, or a mechanic who happens to be looking under the hood of your car, your precious car, and says that you're going to need to have a particular part replaced or a maintenance issue done, ultimately you have to go by your trust in that person. And please, nobody get mad because I'm using the term a mechanic in the same point as a doctor, because some people get a little freaked out. I'm not a mechanic. Yes, I know. You're not a mechanic, and that's probably why you don't do your own car. All right? So we have to say the same thing, incidentally, about demographics. Now, Mike and I are trained and experienced looking at the demographics of locations. Some of the locations we're looking at are very good, and sometimes they're going to be bad. And our job isn't to try to convince you to do one thing or another. And by the way, we don't get paid whether you do go into an office or not. We only get paid for telling you, here's what it looks like to us based upon our experience and the data that we'll present to you. The expectation is that we're going to be honest and that you're going to say, that makes sense. They're credible. You have to do that with every expert in your life. Now, I want to talk briefly, and by the way, I am sorry I'm going a little long, but I think this is important. I want to talk to you about journalists. Now, I don't know if you know this or not, but when you become a journalist, do you know what kind of certification you get to become a journalist? None, okay? By the way, there is a peer review that they get through Sigma Delta Chi, which is their organization for ethics in journalism, and a large number of them fail those ethical guidelines and still continue to work. So stick with me here. This journalist who happened to write this article talked to a few people. did some examinations. They don't know anything about dentistry. They don't know anything about clinical care. They don't know anything about ethical care. But they've talked to a few people, probably a few attorneys, and maybe a couple of people who are opponents of the profession. And yes, there are several. I have talked to faith healer dentists, those people who believe in the laying on of hands that a tooth can be restored or grown magically within your jaw. Yes, I'm going to tell you I treat these people with disdain because they're not using good science. The point is, there are going to be people who will give to these journalists a counter argument. Fine. But the problem is what they do with that information. And that's where I have a problem with Jabbar. That's where I have a problem with the article, The Truth About Dentistry. Because the reality is, he doesn't know the truth about dentistry. He doesn't work with you nearly as often as I do. I've been in your offices. Mike and I go to practices all over the United States. We talk to doctors. We find out what people think about those doctors. And I have done lots and lots of patient surveys and interviews. The point is, he hasn't. And I think that that puts us in a better position to evaluate, but it doesn't mean that I know everything. Mike doesn't know everything, but we know more. The reason that Jabbar wrote the article is to get headlines. He wrote it because this is going to increase his personal reputation. People are going to want to read his stuff. People are going to have him on for interviews. They're going to pay him. This is what he does for a living. I'm not trying to say he's out to get dentistry, but I am saying he's out to get publicity, primarily for Jabbar. Knowing that, I hope, will at least put to bed any fears you may have that he knows something, and he really doesn't. But there is an iatrogenic effect to what he's done. And I want to just go to a couple of those right now. An article appeared in the Lancet, I believe, about a potential problem with vaccinations for children. It was vilified later, and a peer-reviewed article says, no, you're not going to get autism from a pediatric vaccination. That isn't going to happen. And yet, it plays to a certain fear that people have that saying, oh, I am not going to have my child inoculated because they might get autism and die or be retarded have retardation for the rest of their lives. They are very upset. But the point is, journalists did that, and they did it on purpose. They did it so that they can get lots of headlines, lots of opportunities to speak, and it hurts people. Right now, the measles epidemic is going on throughout the United States that should have been eradicated years ago. Polio is making a comeback in certain places. There are so many inoculations and vaccinations that would save lives, and yet journalists are using these things for their own agendas. Well, I'm going to tell you something. That's an iatrogenic effect. The article is the same thing because someone's going to say, my dentist is screwing me over. I'm not going to trust him. I want a panel to tell me what to do. I'm not going to go. And they're going to suffer. They're going to lose teeth. They're going to lose gum tissue. They are going to lose overall health because that is necessary. I just want you to understand, these journalists don't love you, and very often they don't know what the heck they're talking about. We all talk about, kids are too obese. Kids are obese. Bad parenting. Well, the truth is, so many parents have been told stories about children that have been kidnapped in their front yard. It's a bunch of garbage. It's not true. And yet that's the effect. So on one hand, we got to say, yeah, we love truth. The other hand, we got to say, got to be a little cynical and suspicious about what a journalist who's not a professional in their field knows anything. Now, I asked Mike to ask some questions, maybe make sure that we're doing this so that everybody knows I'm not just doing this off the top of my head. So, Mike, did you have any questions?
So I think, and maybe we want to carry it over to the next episode when we do next week, but I think it would be a really interesting discussion to talk about the other side of that. So let's assume that article, would you say, comes out in May? Is that what you said?
It's available online right now if you want to look it up.
It's going to come out in print in May.
Yeah.
So let's assume that article gets a lot of travel and is picked up and people see it on the nightly news and that kind of thing. what do they as doctors, how do they deal with that? And what can they do now? And I think even in a more broader conversation, how do doctors deal with the PR crisis? I think that is a really interesting discussion that impacts a lot of things, including practice placement. I think both of us have worked with doctors who have frankly been run out of town in certain areas because of a PR issue, sometimes warranted, sometimes not. And so I think there is a good strategy there that doctors can take to deal with the PR crisis. And I don't know that I classify this as a PR crisis necessarily, but in some parts of the country, especially urban areas, it may be pretty impactful.
Well, I think it will be a PR crisis. And by the way, you know that I used to teach the spokesperson training program for the California Dental Association. I've trained hundreds of dentists in this issue for the media as well as for their offices. So I'm going to say a couple of things right now that might be of use. Number one, don't back off. Don't hide. Don't act ashamed. Don't think, oh, they got me. They didn't. And I want you to be able to say that with conviction. You got to look the reporter, the patient, the friend or the family member, even your mother-in-law, right in the eye and say, no, this person is not an expert. They don't know. I do. This is what I do every day. So you've got to have the force of your conviction, number one. Second of all, I want you to have a few talking points. And in public relations, they call them key points. I want you to have at least 3 to 5 that you're going to be able to respond to anybody who might doubt your credibility based upon this article. And I recommend you read it and come up with your own talking points. But one of the big ones is the vast majority of professionals are not overdiagnosing. They are spending many, many hours beyond what they need to, required by law, to maintain their license in continuing education. I am amazed at the quality of the continuing education that is available and the amount of education that you receive. Trust me, you're obsessive and you need therapy if you do as much as most dentists that I know. Okay, I'm making a little joke, but it's still true. And one of those other points I want you to know is that there is an agenda that exists among journalists to try to get you. And I want you to make sure that you're aware that that has happened in lots of areas in the news right now. This is not the time in which they're covering themselves in glory. So I'm sorry. But those are things that I want you to have prepared, and that's what I want you to act with. It's your attitude toward this story that will make a difference. I'm sorry, Mike, go ahead. Do you have anything else?
I think that some doctors, as they watch this, may get really nervous. And again, I wonder what beyond those few things, getting the talking points, whatever, do they go on the offense? Do they put something out there? Do they do an interview with the local news? Do they, bump up their testimonials on their website? Do they, try to gather more reviews to try to combat the possible negative impacts that may be had?
Well, I'm going to suggest that if you do have that immediate reaction, first of all, coordinate with your component and constituent societies in the ADA and the AGD. That's probably going to be the most logical, reasonable thing to do. Should there be a reaction? I believe there should be. Just don't expect, by the way, that if a single newspaper or media outlet hears 30 or 40 dentists calling saying, burn the place down, it's not going to help. I really want you to be prepared primarily in your office, among your own social network and your patient base. That's really where the strength is going to be. Make sure that your staff is completely committed as to defending the profession of dentistry, because they're a part of it. So I don't want to suggest that you do something that may not be effective or may actually hurt the profession overall. So, yeah. Now, are there some places in the country it's going to matter more? Yeah, probably. Those people who are in rural locations are the ones who are most susceptible because there are so few voices, particularly in organized dentistry, to act on your behalf. So let's kind of keep that. I will be writing some editorials and articles myself defending the profession. One reason the profession may not have done anything recently is they may feel like we don't want to look guilty because we're trying to respond too quickly.
Yeah.
And I don't let that bother you.
Another thing is I think that it's a good time for doctors, whether they're dentists or vets or or optometrists, it doesn't matter, but to really kind of review their strength of their community. And there's some fantastic books out there. Seth Godin's got a great one called Tribes. There's a really, really great books out there on building your personal community. And in 2019, that is what it's all about. People are members of different communities, and your patient community is no different than that. And so if you feel weak in that, you might want to get some outside help, frankly, on building that community, at least learning how to maximize the community that's there, including social media, including your inter-office communications, and a variety of other things. And so that is something that Dr. Demographics can provide. Again, yes, we are the practice placement professionals, and that's what we do best. But we are also, both of us have extensive marketing knowledge and have done this very thing for offices all over the country in different crises. And so it might be a good inventory time for the doctors to take a look at their personal community and say, yeah, maybe I need some outside help.
If you are interested, I will make available on our website some things you could put in your own newsletter or communication to your patient base if you hear about it. But if you don't hear a lot of discussion about it, let it go.
Don't put gas on the fire.
Well, do put gas on the fire if it makes you warm, but otherwise it's not a good idea. And stand back, for heaven's sake.
Please.
So part of what I want to do is just invite any comments. Please write to us at info@drdemographics.com. We'll also be posting to dentaldemographics.com. I don't know. I've got a mental thing. I'm sorry. I'm old. All right. Leave me alone.
You're so riled up too, so it's understandable.
Yeah, it's true. So anyway, we'll have a little word, just a couple of paragraphs that you might want to share with people in response to this. But please feel free to share this video and the podcast. I'm going to put a transcript of this podcast on the posting that we do. So you'll actually have our words in order to quote as you see necessary. But we are on your side. I want you to know that. And I look forward to having any discussions that we can to help strengthen you and to buoy you up against stupid comments that may come to you from local reporters who may want to.
Yeah. Right.
All right. So listen, our time's a little bit over. Thank you so much for watching this. And please feel free to share it with your friends and neighbors. When you want to find the perfect place to practice, remember, what makes it perfect isn't the place, it's going to be the doctor. You'll make it, and that's where we want to be able to help. Everybody, thanks again for watching, and we look forward to talking to you in the future. Take care.